It's now my pleasure to introduce Tyler VanderWeele, who's one of the architects of the Human Flourishing Program at Harvard, who's going to talk about the new data on the power of forgiveness. So thank you.
I'm Tyler VanderWeele, Loeb Professor of Epidemiology at the Harvard T.H. Chan School of Public Health and Director of the Human Flourishing Program at Harvard, and I will be speaking today on the power of forgiveness. We've all been hurt by others, and it can be difficult to know how to deal with such hurts or with those who inflicted them. One approach is to try to bury and suppress the wounds, but often they remain with us and reemerge. Another approach is to let the wounds fester, to ruminate upon them and upon anger and possibly seek revenge. Sometimes that revenge may help pacify one's outrage, but other times it may not. An alternative approach to dealing with the hurts we all experience is forgiveness. We might define forgiveness as the replacing of ill will towards an offender with goodwill. Conceived as such, forgiveness is distinct from excusing or condoning the action. It's distinct from reconciliation. And it doesn't require foregoing justice. One can forgive an offender and hope for his or her ultimate good while also pursuing a just outcome. One can also forgive an offender without necessarily seeking a restored relationship. Because forgiveness and reconciliation are not identical, one can also forgive even someone who's already passed away. And in conflicts where both parties are hurt, forgiveness can often be helpful in both directions. Prior research on forgiveness has included randomized trials of forgiveness interventions and longitudinal analyses of observational data. This research has indicated that forgiveness lowers depression and anxiety. Forgiveness over time can help free the victim from the hurt, from rumination and suppression, and from the offender. And once again, one can pursue forgiveness and justice simultaneously. Most prior forgiveness interventions have required many sessions with a trained therapist. But in our recent randomized trial from the Human Flourishing Program at Harvard, we examined whether the past 30 years of work in clinical psychology on forgiveness could be distilled into a simple self-guided workbook that takes 2 or 3 hours to complete, and whether that would be effective at promoting forgiveness and improving mental health. If so, I think the case for dissemination of these workbooks and the public health consequences of this could be quite profound. The workbook we studied was based on Everett Worthington's REACH model of forgiveness, where each letter of REACH stands for a different part of the process. R is recall the hurt and the emotions associated with it, let those surface, don't suppress them. E is empathize with the offender, try to understand their reasons for action without condoning the action or invalidating one's feelings. A is altruistic gift. Realize that forgiveness is an altruistic gift that can be offered or withheld, and realize also that one has oneself sometimes done wrong and has been forgiven. C is commit to forgive, try to replace the ill will with goodwill. And H is hold on to forgiveness, realizing that it takes time for the emotions to heal, that sometimes the anger will return, but that doesn't invalidate one's commitment to replace ill will with goodwill. This workbook was developed by selecting the most effective exercises from prior research so that the workbook could be completed, again, in just 2 to 3 hours to help people who want to forgive but are having trouble doing so. So we carried out a large waitlist randomized trial to evaluate the effectiveness of this forgiveness workbook. The study had about 4,500 participants in 5 relatively high conflict countries: Colombia, South Africa, Ukraine, Indonesia, and Hong Kong. And so in this trial, participants are randomized either to receive the workbook immediately or after a delay, in this case 2 weeks, and then outcomes are measured right before the second group gets the workbook to see if the workbook was effective during those 2 weeks at improving forgiveness. And we found that it was indeed effective at improving forgiveness, about a half a standard deviation, so a pretty large effect. Moreover, there was also evidence that the forgiveness workbook lowered depressive symptoms, lowered anxiety symptoms, increased hope, and also evidence that increased various aspects of flourishing: happiness, health, meaning, character, relationships, and even a sense of financial security. Effects of forgiveness can be quite profound. Given these important effects on mental health and well-being and the existence of these effectively costless, easily disseminable, self-guided forgiveness workbook interventions, I think a case could be made that forgiveness should be considered a public health issue. The public health impact of a particular exposure or phenomena is sometimes assessed as a function of how prevalent or common it is and the size of its effects on the outcomes we care about. Something that's both common and has large effects on the outcomes we care about will shape population health. So on these grounds, I think forgiveness is important. The experience of being wronged is very common, and forgiveness, which can be fostered by the use of these workbooks, can itself improve mental health and well-being. So I do think if these workbooks were disseminated in clinical, school, workplace settings, and if local, national, international efforts were made to promote forgiveness and utilize these resources, that people would forgive more and reap the benefits of improved mental health. The Forgiveness Workbook can be downloaded from Everett Worthington's website or from the Human Flourishing Program website and freely distributed. I've personally used it myself and have found it very helpful. There are questions that are sometimes raised. Is it always morally appropriate to forgive? And arguments have been put forward that provided the victim doesn't deny the wrong that was done or the implications or deny or suppress feelings about forgiveness, forgiveness, understood simply as replacing ill will towards the offender with goodwill, can always be more morally appropriate. Again, forgiveness does not entail foregoing justice, and this distinction is especially critical, I think, if forgiveness is to be promoted in clinical or community settings and in thinking about the morality of forgiveness. I think forgiveness perhaps also points towards the need for love within communities and a restoration of love when things go wrong. It arguably points even to the need of love of one's enemies, of those who have settled ill will towards oneself, or those towards whom one's inclined to have settled ill will. Society has become increasingly polarized, and we certainly won't agree on everything, and those disagreements can be important, yet it's also important to recognize the humanity of those we disagree with, to understand those differences, to work towards finding those aspects of what is good and what we can agree on and seek together. There's a paradoxical logic of love for one's enemies and of forgiveness. And by replacing ill will towards another with goodwill, forgiveness may prompt pro-social action that itself may propagate, potentially leading to helping to heal division. I think our society needs to foster a greater love for neighbor, a greater love for enemy even, and forgiveness can facilitate that and facilitate a fuller flourishing. Thank you.